Okay, now we are down to my last topic, the introduction to urinalysis. So, before you proceed to the three phases of urinalysis or urine analysis, let us have some introduction, no, before tayo go through. So, literal ni siya. So, history of urinalysis and its importance. So, you can see here, natin mga picture, no? Sa una, ang panahon nila kay analyzing your urine. This is actually the first or mo ni siya ang nagpasugod sa laboratory medicine. Sa una, no, kita man yung mga picture, no, sila kanang mga flask, no, nasli tan-aw, ginatanaw sa mga physician sa una ba ang mga urine sa mga kaunan sa mga tao, and even sa mga hieroglyphics sa Egypt mana, sa mga papyrus ana kay even cavemen, no, mura sila nagatanaw, nag-check or nagkuan sa ilang mga ihi. Okay, so in the past or in the history of medicine, no, there has been many names nga na nag-associate sa urine, sa pag-study sa urine. For example, si Hippocrates, no, he wrote a book on uroscopy. Okay, siya na study of uroscopy, meaning tanaw guro siya og i-check og study niya ang urine. Okay, and also color charts had been developed, okay, to describe 20 different colors of urine. Okay, so kita nyo diri sa picture, actually kaning tabule, so mo ni siya. Okay, so mo ni ang color charts pero dili walay color. 20 ni ka different colors of urine. Mo na lang ginabasihan ba yan color, possible man yung mga sakit. Okay, and then sa una ang ihi ilang ginahimo is ilang ikuan ang ant, no, ang kanang mga humigas. So meaning kung kanang ihi kay humigason kasi na kay kanang kuan tamis kay ihi, no, or kanang na testing for glucose sa una by Frederick Deckers. Okay, and then ang uban pod kay tilawan gyud nila tamis, okay, no, so karon wala naman tanang tilaw-tilaw, so wala na ta na kay modern naman tay mga modern nga mga technologies and procedures nga gina-follow, of course. And also in the 17th century, na discover man or na invent man ang microscope. So that also led to the examination of the microscopic elements that is found in the urine. And also Thomas Addis nagkuan siya og method to quantitate microscopic sediments. Okay, and daghan mga tao nga they have devoted their time to study the urine. Okay, so Richard Bright introduced ato na ning i-appeal sa routine patient examination ang urine. Okay, pero as the time goes by, nagka-complex, nagkadaghan man ang test performed in urinalysis, yung para nila yung practical naman yung sud naman ni, so hapit siya nga mawala sa routine exam. So may gani kay giluwas siya. Okay, so there were two characteristics of urinalysis that led to its continued popularity until now. Even now, gigamit siya as routine part sa patient examination. So one is urine is readily available. So sayon na kay ka mangihi man jud ka. Di na posible man ka mangihi, no? So and it is easily collected. Di ka maglisod. Okay? And then our urine contains information which kanang barato ra siya nya na daghan kag makita. Okay? And especially even metabolic function. So and even makakita ka og example kas, okay ba ka nga na is something wrong with, although routine siya, barato siya, pero daghan ka makita presence of RBCs, presence of bacteria and WBCs. Daghan ka makita bitaw na makuan gani mo nga na problem ang patient. Okay, so urinalysis, according to Clinical and Laboratory Standards Institute, this is the testing of urine with procedures commonly performed in an expeditious, reliable, accurate, safe, and cost-effective manner. So, according to CLSI, no, ang urinalysis kay reliable, no? Masaligan gyud, accurate siya, safe pag siya, barato ra pud siya. Okay, dagan kay mahimo. Okay? So, urine composition, urine is normally 95% water and 5% solutes. So, our solutes are divided into two, organic and inorganic. So, for organic substances, we have urea, creatinine, uric acid, ammonia, and also we have our sugars, some proteins, and ketones. So, urea, this is the primary organic component. Okay? So, this is the product of protein and amino acid metabolism. So, mo ni ang major organic component. And creatinine, of course, a product of creatine metabolism by muscles. Mabito to ganina, di ba? Creatinine clearance, bati siya if ang pasyente ka na ay muscle wasting disease. Uric acid, of course, you can also see this. This is a product of nucleic acid breakdown in food and cells. Ammonia, it regulates blood and tissue fluid acidity. And of course, some sugars, some proteins, especially katong gagmay nga proteins, not necessarily albumin, and even ketones, especially if kanang naay diabetes type 1. Okay? And for inorganic substances, the primary inorganic component is your chloride in the form of your sodium chloride. Okay? And found in a combination of your sodium. Okay? So, major inorganic solid dissolved chloride. And then sodium, kaduha siya. Okay? So, primarily, of course, from salt, pinagis itong pagkaon. Potassium also, napo na siya. Okay? Combined with chloride and other salt. Magnesium oxalate also and calcium oxalate. Okay? So, urine volume. The normal daily urine output is usually about 1,200 to 1,500 ml. Okay? But a range of 600 to 2,000 considered normal na siya. For example, 2,000 if kanang suki ka ng tubig, no? 3 liters per day. Or 600 if in case okay inom. Okay pa man na siya. Okay? So, the kidneys excrete 2 to 3 times more urine during the day than during the night. Okay? So, may pagkahimo sa Ginoo kay kanang mas manghihi ka sa buntag kay gamatama ka. Pero sa gabi kung ang uban gali kay manghihi before matulog. Then manghihi na sila balik kay buntag na kanang mata nila, no? Kay importante man gud ang tulog. So para mo bitaw napoy kanang advice nga as much as possible dili ka minom tubig if padong naka matulog. Kay makahion man ka, makamata ka, ma-disrupt man yung sleep. So, pero normally, mangihi before matulog, then makahihi, ugma na sa buntag, mata. So, para full yun yung sleep. Sure. Sana okay. So, an increase in nocturnal excretion of urine is termed nocturia. So, for example, ikaw kay mas palaihi ka in kagabi, so meaning na kay nocturia. Sa gabi ka mangihi. Okay? So, there are also other terms describing different urine volumes. So, oliguria meaning there is a general decrease in urine output. So, for infant, less than 1 ml per kilogram per hour. Children, less than 0.5 ml. Maya, no? Pigli ko na 1 ml, gamay naman kayo na. Pero, 0.5. So, for example, ang kana, mag-calculate ta. So, example, kana nga bata, pila yung edad? Yung timbang, buta na to, 16 kilograms. Okay? Na siya oliguria if 0.5 times 16 kilograms per hour. So, nasa 8 ml. 8 ml nga ihi per hour. Putang na to, 5 ka oras ra siya. Or 3 ka oras ra siya. Wala. So, wala na kaihi. Nasa 24 ml. Pwede yung gamaya. No? Manak kapuno sa kuan. Katong yung sulanan sa ihi. And if adult, kay less than 400 ml per day. May jud kaayo, no? Wa kapuno sa inyong nature spray nga tag 20 na karon. Okay, anuria. Anuria meaning cessation of urine flow. Ay jud ka ihi, jud ka nang ihi. So it results from any serious damage to the kidneys or from a decrease in the flow of blood to the kidneys, no? Ni decrease ang blood pressure ba, decrease ang blood volume, and then wala ni andar imong raas, wala na ka ihi. Polyuria, on the other hand, is an increase in daily urine volume. So, cases of your diabetes. Ba? Diabetes mellitus and diabetes insipidus. That's like polyuria. Children, 2.5 to 3 ml kilograms per day. Pwede na siya polyuria. Adult, greater than 2.5 liters per day. No? Grabe, no? Yung giinom kay wakabot 1 liter, pero yung ihi kay 2.5. So, pa-check na ka ba sina diabetes insipidus, diabetes mellitus, or ba sina tubular damage. Okay? That is for urine volume. So, diabetes mellitus versus diabetes insipidus. Man akong gingon ganina. So, diabetes mellitus, of course, the patient has polyuria, meaning sisigihi. Tapos sila polydipsia, meaning sa polydipsia, uhaw, sige inom. So, you look at the specific gravity, concentrating test, di ba? Screening test, most common concentrating test, specific gravity. Kasi ang you-measure, the number and the mass of your solutes, which is, sa imong osmometer kay, or osmolarity kay, only the number of solutes. So, kanila. And then, sige, balik ta. Polydipsia, polyuria. And then, you measure the specific gravity. If the specific gravity of your patient is decreased, no, gamay ang specific grav. Okay? Tang na to, mga nara sa 1.005. So, the patient could have a decreased production or the function of your ADH. So, it could be nasa neurogenic, no, decreased production, wala nag-produce ang hypothalamus, or nephrogenic, meaning wala di ganahan si walang respond si collecting ducts kang ADH. So that could be diabetes insipidus. And if your specific grav is increased, no, ganong space man pero muta na mangihi. So meaning there could be a decreased insulin or decreased function of insulin. So it could be type 1 or type 2 diabetes, meaning wala gyud nagproduce imong pancreas, your beta cells, the islets of Langerhans, wag yung nag-release of insulin, or na-insulin pero na-insulin resistance, or the receptor, kaya dili sila mag-abot sa imong insulin. And also, you can see an increased blood glucose, and then you can also see positive glucose in your urine, so diabetes mellitus. Okay, so what about the specimen container? When, of course, when urinalysis man tam, hatag man jud ta container sa pasyente. So please take note that the specimen container should be wide mouth. It should be wide mouth. Okay, dapat dako siya o kanang ihang entrance ihang kanang mouth. Dako siya og bangag. And then dapat clear siya, limpyo, dry, leak proof, no? Dapat di siya mag-leak, and disposable siya. According to CLSI, or GPE 16A12, the capacity of your specimen container should be around 50 ml, and the opening should be around 4 centimeters. And dapat ang base niya kay wide. Okay? According to CLSI, this is the standard. 50 ml capacity, opening is around 4 centimeters, and it should have a wide base. For pediatric specimen, wala na ako nabutang picture, bag siya, I think ba nakikita na niyo, or kasi kamutan na nakita na. Bags with adhesive for the collection of pediatric specimen. Buhaton na kay plastic siya, and then imura nang isud ang genitalia sa plastic, and then tape na siya para di matangtang. And then kung manghihina ang bata dito, ito na siya. Sulod ra dito, pero haso lang siya. And sagaran kay mausik, no? Gamay kay makuha. Sige lang. Okay. So for microbiologic urine studies, so we have individually packaged sterile containers with secure closures. Okay? So one example, kaning blue, kanina ay ko, sterile, ready for use. Also, the recommended capacity 50 ml. And for microscopic analysis, transfer ka sa tube is 12 ml of specimen. Okay? And after centrifugation, and then nagdecant na ka, around 0.5 ml ang mabilin for microscopic examination of that sediment. Okay? The specimen labels. How do we label properly our urine specimen? So, of course, we put patient name, if admitted, identification number. We also put the date and time of the collection. Okay? And also, age niya, o ba, butangan pag-asa siya, and of course, healthcare provider's name. O ba, butang pa. Okay, so, specimen labels are very important, dapat na-asya din ha. And, labels must be attached to the container, not the lid. Dapat sa body, dili sa tabon. Basin magka-baylo-baylo, open, udungan ni mo, kwan na. And it should not be detached if the container is refrigerated or frozen. Dapat dili matangtang ang label. Kasi kasi mo siya ibutang. Okay? So, enjoy lang mga memes. So, next, specimen requisition. Specimen requisition form It should be manual or computerized. And dapat uban siya sa specimen delivered to the laboratory. And the information on the form and the information on the label must match. And the time of specimen received in the laboratory should be recorded in the form. Uban maglagbok pa. Okay? Kaya mo pag pinareho na ko, ha? Dapat kung na ay specimen tanaw ng form. para dili mo okay? So, again, we have tackled this during our quality assessment. Diba? Criteria for urine specimen rejection, if walay label, dili magmatch ang label sa request form, na contamination of feces of toilet paper, contaminated ang gawas. Okay? And then, gamay ang urine volume, no? 5 ml ra, ang po gamay. And then, wala na tarong preserve or transport, and then there was a delay in collection and receipt in the laboratory. Okay? And of course, mislabeled. How do we handle mislabeled specimen? Again, do not assume kabalo ka sa specimen or patient. Do not relabel incorrectly labeled specimen. Do not discard unless mahuman ang investigation. Leave specimen exactly as it is and i-preserve it sa ref until ma-resolve ang error. Notify floor, nursing station, doctor sa baba. Identify the problem. Make the person responsible for the specimen collection nga mo participate sa solution of the problem. Okay? And report good all mislabeled specimen to the supervisor. Okay, specimen integrity. So all specimens should be examined within 2 hours. Otherwise, proper preservation must be available. So if kanang tagani, if within 2 hours may kuanan nimo, okay, pero if mulapas na, you preserve it. So most of the changes on an unpreserved specimen at room temperature are related to the presence and growth of bacteria. Kay kung imurang pasagdan ang urine specimen on a room temperature, imong bacteria ganahan manana. Anagana sila mayo, and your bacteria can break down different substances and analytes present on your urine. One of it is your creatinine. Discuss na to sa previous na itong topic, di ba? Nga, your creatinine is broken down by your bacteria. So, importante na siya. So, these are the changes in an unpreserved urine. So, color, mo darken siya kay ma-oxidize man or ma-reduce yung metabolites. Clarity, mo decrease, meaning mo lubog, mo turbid siya kay mo tubo may mga bacteria, and amorphous materials will precipitate. Okay? Odor, mo bahok siya, mo increase. Tungod kay your bacteria will break down your urea to ammonia, bahok mga ammonia. pH will increase, so magka-alkaline siya, kay again your urea will be converted to ammonia by your urease producing bacteria, and also the loss of your carbon dioxide. Glucose mo decrease kay use up sa imuhang bacteria or glycolysis will happen. Ketones mo decrease kay ketones are volatile substances, so it will undergo volatilization, and also your some bacteria will metabolize ketones. Bilirubin mo decrease because of the exposure to light and photooxidation to biliverdin. And your urobilinogen, decrease po siya kay ma-oxidize siya to urobilin. Nitrite mo increase tungod sa imuhang nitrite reducing bacteria. Red and white blood cells mo decrease kay ma-disintegrate, especially if alkaline na imuhang urine. Bacteria mo increase. Trichomonas mo gamay kay di na siya kaliho kay mamatay naman siya. Okay? So, how do we preserve specimen if kanang na-delay of testing? Most routinely used method of preservation, i-refrigerate nimo at 2 to 8 degrees Celsius. If you want to culture it, so dapat i-refrigerate siya, okay, during transit, okay, and dapat i-ref yun siya until you culture it up to 24 hours. And if dili pwede si ref, you use chemical preservatives, okay, and ideal preservative should be bactericidal. Okay? This chemical preservative should be bactericidal. It should inhibit urease. It should preserve the formed elements in the sediment, and it should not interfere with the chemical tests. Okay. So these are some of the preservatives that could be used. So refrigeration man yung most common, man yung pinaka kuan kay naman yung ref kanan yun na ref. Okay? So it does not interfere with any chemical test. But ang yung disadvantage is it raises the specific gravity if you use hydrometer. Okay? But then, of course, wala naman tayo nag-use hydrometer, gamit naman tayo reagent strip, so okay na siya. But it also precipitates amorphous phosphates and urates. So, lubog imuhang clarity. But it prevents bacterial growth in 24 hours. So, mo na if mag-urine culture ka, pwede rin mo i-ref around 24 hours. So, you can also use thymol, boric acid. Boric acid should be stored at room temperature. And also formalin and chloroform. So, thymol if you want to preserve glucose and sediments well. Okay? But the problem with thymol is it interferes with acid precipitation for protein. And large amount of thymol will interfere with toluidine glucose test. Boric acid, on the other hand, it preserves proteins and sediments. Thymol, glucose and sediments. Boric acid, protein and sediments. And it does not interfere with protein analysis other than pH. Kasi pH, acid man siya. So, of course, acidic yun yung pH. But if large amounts of boric acid may precipitate the crystal and it interferes with drugs. No, tutol siya. Okay? Yun lang. And boric acid must be kept around 6.0 nga pH. And your boric acid is bacteriostatic. So it can be used for culture transport. Bacteriostatic, it does not kill the bacteria, but it stops, it holds the growth of bacteria kaya gina-stop man yan. Formalin, this is an excellent sediment preservative. Formalin. But it interferes with the copper reduction test for glucose and causes clumping of sediments. Could be used to rinse container for cell counts for preservation of cells and casts. Chloroform, disadvantage, it interferes with sediment analysis batication and it can cause cellular changes. So we also have toluene, sodium fluoride, phenol, commercial preservative tablet, urine C plus S transport kits. So, this table is found in your compilation, so you can fill it up. Okay, so phenol, it does not interfere with your routine test, but it causes odor change. And use 1 drop per ounce of specimen lang. So gamay lang yun siya. Okay, so your toluene, flammable lang siya. Your sodium fluoride, on the other hand, it prevents glycolysis. Kaya, di ba, your sodium fluoride is also an additive found on your gray top tube. But if you want to test glucose or you want to measure glucose, and it is a good preservative for drug tests, sodium fluoride. And we also have commercial preservative type tablets. Ang ba mo na ginagamit karon, okay? Urine C plus S transport kit, it is used for urinalysis and culture because it can be run on the same specimen. But the problem niya, i-decrease niya ang pH, okay? So when you want to you can use boric acid as a preservative ani nga transport kit. Also we have gray CNS tube, yellow plain UA tube, cherry red, yellow top, and Sakumano. Okay, so for your gray CNS, it is stable at room temp for 48 hours. Okay, so it preserves your bacteria. Yellow plain, automated instruments. Mo yung gamit sa automated instruments. And cherry red, yellow top, stable for 72 hours at room temperature. And it is also instrument compatible. Okay? Sa Kumano, it preserves cellular elements and it is used for cytology studies. Okay, so type of specimen. So, the conditions for us to obtain a specimen that is truly a representative of a patient's metabolic state. So, dapat ato ning i-observe. The time of collection, the diet of our patient, and the medicinal intake of our patient, the length of collection period, and the method of collection. So, importante ni sila nga mga factors para ma-ensure na to nga ano giko nga specimen is truly a representative of the metabolic state of our patient. So, we have random specimen, first morning specimen. So, there are several specimens here. So, random specimen, this is the most commonly received. Kuha na to sa laboratory. Random specimen and using the midstream clean catch nga method. So, advantages of your random specimen, sayon ra kuhaon, useful for routine testing, screening, okay, convenient sa patient, lack of convenience. But disadvantage niya kay it can produce erroneous result. Kay what if sabi ka unsing pasyente bago orang kaon ng pasyente nimo din ha or basin bago siya nag-exercise. Okay, so kana pwede siya random ra mo kay siya. So daily controlled ang kuan ba ang situation sa patient. So Oh, so that's random specimen. So any time of the day. First morning specimen is ideal. Si random is the most commonly received in the lab. First morning specimen is the ideal specimen for screening. And it is essential to prevent false negative pregnancy test. Okay? Grabe man ni siya ka concentrated. Okay? And your first morning specimen is also used to evaluate orthostatic proteinuria. Okay? And advantage of your first morning specimen is concentrated siya and assured jud ka nga nakay ma-detect na chemicals and formed elements. Okay? So, how do you collect first morning specimen? Immediately, ibangon nimo, kuhaon nimo ang ihi, and then you deliver it to the laboratory within 2 hours or keep it refrigerated. Okay, so we also have fasting specimen, termed as your second morning. We also have 2-hour postprandial specimen and our 5-hour time during specimen. Fasting specimen, this is second voided specimen after a period of fasting. So this is used for glucose, diabetic screening, and monitoring. So second morning siya. So after a period of fasting, after ka nag-fast, nihideng ka. Okay? So 2-hour postprandial, so it is used to monitor insulin therapy in persons with diabetes mellitus. So 2 hour after kaon. Okay? And also 5-hour time during specimen. This is for D-xylose absorption test to distinguish pancreatic insufficiency from intestinal malabsorption. Okay? So, ang gaming reagent is your D-xylose. So, either D-xylose is a sugar, so either wala nag-produce og tawag ni ang pancreas o hormone to metabolize your D-xylose, or base your D-xylose is not absorbed in your intestine, so wala siya nagamit gihapon sa blood, or wala siya nakuha sa blood. So urine is collected 5 hour and blood is also collected 2 hours after ingestion of 25 grams of D-xylose. So 25 grams intake na sa pasyente, and then you collect after 2 hours you collect blood, and after 5 hours you collect the urine. So kita din ha if your D-xylose is metabolized by your pancreatic na enzymes, or basin there is intestinal malabsorption, wala siya na absorb. Okay? After the patient taken your D-xylose. Next, 24-hour timed specimen. So this is usually used for clearance test, creatinine clearance test. So this is for quantitative chemical test, and the patient must begin and end the collection period with an empty bladder. So mano siya. Pero kung gi-explain gani nga, alas 7 sa buntag sugod karon, alas 7 sa buntag the next day. And dapat empty bladder jud ang start. So 7 a.m. kung na pa siya ihi ana, iyan ang i-void. And after voiding it, the next niya ihi mo na tiyang isulod sa sudlanan. Okay? And after 7 a.m. on the next day, so if na pa siya ihi na naka-store at 7 a.m. hindi pa siya kahiyon, dapat kuhaon isulod na niya kapil sa sudlanan, kaya ang urine nga na form ana is before 7 a.m. pa. So what happens is you give the patient 4-aminobenzoic acid at the start of the collection, and there is a concentration of excreted marker is measured to determine completeness of collection. So there is for you to know if completo, there is a certain concentration of your creatinine, which is nalimot ko. Sorry. So nalimot ko na a certain amount, certain concentration of your creatinine nga ingon ka nga kompleto. Kay if maubos pa ana, meaning wala na natarong og collect, or wala na kompleto ang pag-collect. So here's the procedure. Of course, you give proper containers, patient and preservative. Money 7 a.m. first urine, i-void nimo, discard na nimo, and then you collect all urine for the next 24 hours. Day 2, 7 a.m. First urine, patient voids and adds this urine to previously collected urine. Okay? So mga na kami ganyan. For catecholamines, pwede po siya. Storage is if we want to measure catecholamines, especially its metabolic product, your vanillyl mandelic acid, sani? O kana, BMA, you store it with a pH of less than 2. So you add 10 ml of 6 normality of your HCl to the container before you collect the specimen. Okay, for pediatric specimen, para sa mga bata, so we use soft, clear plastic tags with hypoallergenic skin adhesives. So we make sure that the genital area of the patient should be free of contamination. And when enough specimen has been collected, you remove the bag, then you label it, and then you pour the specimen into the container and label the container. And for pediatric specimen, check the applied bags every 15 minutes until the needed amount of sample has been collected. Okay? Kasi nangas ba ang bata, tang yan nila ang kuan, sudlanan. Okay? We also have catheterized specimen, suprapubic specimen, and midstream clean catch. Catheterized specimen, this is collected under sterile conditions, so gikan jud sa catheter. Yung catheter nimo kay gisulod bina, that's a tube that nga gisulod jud dito sa imuhang bladder. Okay? So ang gawas pag ihiana dito na dito sa sudlanan, so limpyo siya. This is commonly used for bacterial culture, also routinely for kidney function. So kuha ra ta dito. Suprapubic on the other hand, kay medyo invasive siya, kay we introduce a needle in the abdomen padung sa bladder, and then ato aspirate na dito didikita ang physician. So this is free from extraneous contamination. This is also used for bacterial culture and even cytology examination. Midstream clean catch, money kasagaran if random kay money ang Paris. Midstream clean catch, safer, less traumatic, and this is the alternative to catheterized specimen. It's also used for routine and bacterial culture, routine testing and bacterial culture. Less contaminated by epithelial cells kay itong atunga man. And it is a more representative of actual urine than the routinely voided specimen. And we can use mild antiseptic towelettes to clean the genitalia. And then advantages of midstream clean catch, less contaminated by epithelial cells and bacteria, and more representative of actual urine. So what happens with your midstream clean catch, of course, you instruct the patient, ma'am, of course, you ipa-clean ang genitalia with mild antiseptic towelettes, and then you instruct the patient na ma'am, i-void sa ang first part sa imong pag-ihi, and then tunga sa imong pag-ihi mo na imong i-catch, mo ito midstream clean catch, and then catch nimo, and then nantod sa makuha na ang desired volume, and then after anak i-void na nimo, i-discard na nimo ang remaining ng urine. Mana siya. So glucose tolerance specimen, so this is collected to correspond with the blood sample drawn during OGTT. So, OGTT, perform niya especially sa mga MABDUs. Kaya para ma-determine if na ba sila GDM or na ba sila risk for GDM. So, urine is tested for glucose and ketones together with the blood sample drawn. So, your OGTT may include fasting. During fasting, wag dugo, ngihi. Then, auban ay half hour. Auban dito nag 1 hour. Then 2 hours, then 3 hours specimen. So, umana na fasting is like 6 to 8 hours. Kuha sila dugo, mangihi sila, after pwede sila makaon. Malagkaon, after 1 hour, balik sila, kuha sila dugo. After 2 hours, kuha na po sila dugo. 3 hours, kuha na po dugo, ugihi. Okay? Pwede ang uban, maabot pa 4 hours, 5 hours, 6 hours, dugay kayo. But depende ni siya sa laboratory. Okay, we also have the 3-glass specimen. The 3-glass specimen is used to determine prostatic infection. So, tulo ni ka specimen. So, 3 glass man. So, tulo ka bottles, tulo ka bo. First is, you collect the first urine passed in a sterile container and using the midstream clean catch nga method. Okay? The first is, you collect the first urine jud, katong first nga void nimo. Imo na i-collect. And then, ang midstream nga part sa ihi kay mo po i-collect on another container. After that, you massage the prostate para ang prosthetic fluid kay mo gawas maapil siya ihi para sa ikatulong nga sample. Okay? So first nga bottle is katong pinakauna gyud, ihi gyud isawd. Tunga isawd po sa laing nga container. And then you massage the prostate, and then ihi balik, you put it in a third container, apil na din na ang prosthetic fluid. Okay, so if you want to culture quantitatively, we use all specimen. For microscopic examination, we look at the first and the third. Kaya ito man ay compare. Kaya katong wala pa na massage ang prostate o ang pag-massage. Okay, it could be kay prostatic infection man. So kung ang bacteria kaya nasa first, okay, then after sa pag-massage kay naagi hapon siya, or I mean pag first kay wala, and then pag massage sa prostate kay naa siya. So it could be nga due to prostatic infection ng patient. Okay? And also, your second specimen is the control for bladder or kidney infections. Kaya diba your second is katong midstream clean catchment siya. So siya ang control. So for example, imong first kay naay bacteria, and then ang imuha nga second kay naay bacteria, and then imong third kay wala. So it could be nga bladder or kidney infection siya. But if for example, first na, second na, third na, it could be nga prostatic infection siya. Okay? Or for example, si first, second wala, third kina prostatic infection siya. Okay? So how do we know if na siya prostatic infection? So the third specimen will have a WBC per high power field count and a bacterial count 10 times that of the first specimen. So first specimen ng bacteria, sa third specimen mo after ka nag-massage, mas didaghan ang bacteria. And also you can see macrophages that contains lipids. Okay, kita po ka na. Okay, drug specimen collection. Drug specimen collection, urine specimen collection is the most vulnerable part of drug testing program. Okay? Sa'yo na kayo ni, pero daghan yung mga pukus-pukus mga tawa ni. So, during drug specimen collection, chain of custody is observed. What is chain of custody? So, chain of custody, meaning, na-explain na ako ato sa previous nga topics nga, chain of custody meaning kay, at every step of the process, kay gina-document yun siya. Okay? So, chain of custody is the process that provides a documentation of proper sample identification from the time of collection until ma-receive siya sa laboratory, or until ma-receive ang laboratory result. Okay? So, meaning every step of the testing kay documented yun siya. And every step kay kanang from the collector until pag-abot sa laboratory, kanang naagyod siya documentation. Mo gina siya, chain of custody naagyod siya. Okay? And to observe chain of custody, it could be witnessed or not witnessed. So, witness collection, document proper sample identification from time collection to receipt. Okay? Date and time, and all personal handling must be noted. So, nagyod, i-con yun na siya, document yun na siya. Nakasuway naman siguro mo pa-drug testing nga igihi ninyo, di ba, kay dili pa ipasarado fully yang ang inyong bowl, kay walay flash nga color blue ang tubig, kay para dili yun makapanikas ang tao. And the amount of urine volume nga required is around 30 to 45 ml. If di ka abot dira imong gihatag ihi pa ihiyon siya kag balik. And urine temperature must be taken 4 minutes yun. Within 4 minutes paghatag nimo, kuha na day na siya from the time of collection. And how the temperature will also say if adulterated na sample or date, because a temperature of 32.5 to 37.7 mo man na ang range of temperature na acceptable. If dili na mo fall na din na adulterated imong specimen. And signs of adulteration, if yung pH kay greater than 9.0, no, lapas man sa normal nga pH sa urine, and your specific gravity is less than 1.005. And again, collections may be witnessed or unwitnessed. If witnessed, dapat same gender ang mo uban sa imuha. Okay? When you collect 30 to 45 ml. Okay? And also when it comes to urine temperature, if the urine temperature is outside this range, kanang recommended range na to, 32.5 to 37.7, it could mean nga na specimen contamination or na adulteration, so second specimen is necessary. Okay? So, yes. And here, it ends our discussion for introduction to urinalysis, and also from the other nga discussion. So, I hope nga You'll be able to scan through these videos and fill up your compilation notes and study, okay? Familiarize, what nasabtan kay balik, or you ask. And more importantly, you ask the Lord, you ask for guidance, because nag-promise man siya, okay, na He will give you strength and He will give you courage, and do not be afraid. I know nga dili kayo nindot ang kuan karon, especially nga there are some of your classmates nga nanghawa and all, but the Lord has said nga we should continually be strong and a good courage, and I know that the Lord will also guide them kung asa man ang ilahang agi pili nga path karon. So hinahinay lang, take one step at a time, and padayon lang yun, okay? So you will get there, okay, by God's grace. So thank you, and God bless in your studies, and see you this Friday. Bye. God bless.